Raj Karishma.
I'm Mrs. Indumati Mani, and the patient, my mother, is Mrs. G. Santan Lakshmi, and she was admitted on the 7th of this month with some symptoms which prompted me to admit her. What was unusual that day is she had a lot of fatigue and she was not her normal self. She was inactive and going off to sleep more often, and a little bit of breathlessness and loss of appetite. So these are the main symptoms which made me feel that she should be taken to a hospital. I took Dr. Karishma's name basically because I thought my mother would be comfortable with the woman, and we realized that we made a good choice. That day itself, on the day of admission, she was very much here, and she tested her and she said that she needs to be on a ventilator and that she'd be spending that day in the ICU, and she acted very fast and gave us all the indications as what prompted her to put her in an ICU and what further investigations she started that day, and she kept us briefed about everything.
Yeah, so I think I happened to reach from that evening, the same day she got admitted, a few hours later. So I had the opportunity to meet Dr. Revati Iyer, and she was in charge of the ICU. That was an amazing experience, A, because she's very, very knowledgeable, and B, she also could speak our language, which happens to be Tamil. So my mother understands that very well. So she was very nice in explaining to us what's going on. So I appreciated that very much. And she recommended she will need to be here for a few days because there are obviously some things that bothering her. She run more tests, but she said she will walk out of this hospital. So that was on day one. She gave us the comfort because obviously it's a stressful time for the family. So having somebody like her giving us the thing, I think we had an amazing start with both those doctors, I would say that.
All of them were very encouraging to my mother. They were very cordial and gave her a lot of importance and interest as a patient. She was dealt with a lot of care. So that's what really matters to the relatives and the patient. Dr. Madhav is really amazing. He used to come every day and talk very nicely to my mother, and he gave us a very enlightening speech every day about what causes kidney disorders, and enlightened us a lot. So very thankful to him. Cardiologist was coming on a daily basis and he had ordered an ECG every day. So he didn't interact much, but he gave us a lot of hope that there's not much to worry about as far as her heart is concerned. So he was also doing a great job.
I've been to hospitals like Stanford in the US as well as Washington in California, but Bangalore, many hospitals. I will say I rate this probably the best experience I had. I'd say for two reasons. One, I like the staff who are extremely happy people and fully motivating and not seeing it as a job. They actually really do care about their patients.
Especially the nurses and the other staff also. They've done a brilliant job and we're thankful to them. And, they are really unsung heroes, but they do a lot. So a lot of credit should go to them.
I recommend this hospital to anybody.